So in Egypt currently we have almost 300,000 cases of stroke per year, which according to statistics, 10% of them should do thrombectomy, which is almost 30,000, which actually they don't do. We don't even reach 1,000. We have stroke services in Egypt, but they are sporadic services in different hospitals, government and private. But they're not actually under one umbrella and not actually under one protocol and policies and procedures. So all this raised actually a red flag that made us as a government start seeing the importance of working on stroke and putting it on the top of the list. So in the last 3 years, we installed more than 350 CAT scans. And then during this, parallel to that, we started installing MRIs. We installed in government hospitals more than 28 MRIs currently. And we installed in the last 2.5 years more than 36 cath labs. This was a true heavy financial burden on the government, but we still, as considering ourselves strategizing under one main thing, which is patient healthcare. We are patient-centered. Being patient-centered, we should search for the best quality of life for the patient. And with the number of the stroke patients that we are having every year, so we have almost 60% to 70% of these patients, they return home debilitated. So working hard on early detection and early management, this is the primary goal in Egypt. So after starting the first phase, which is installation of the machinery, now we're going to the second phase, which is that we have more than 90 primary stroke centers, 35 of which are accredited from the WSO, and the rest are on the process. We're going to start by 4 centers, first in the center, and maybe in 6 months, we're going to make them 8 centers. They are full-scale comprehensive centers, because the idea is that having the service all over the country is that when you put a stroke center in area, you only have this catchment area where the patient benefits from. But there are the geographic areas the patients don't benefit. So it's how you geographically distribute these centers in order to be able to get as much patient catchment and benefit to the patient as you can. And with this parallel, we start working on educations and training and awareness. And I believe, and the government believes, that true awareness for the community, for the people to start coming. And we already, as Egypt, have a huge success story in this, in early detection of liver cancer in virus C. And we eradicated completely virus C. And we are planning to do it on stroke, because now stroke is put on the top of the list in our work. Ending by a small survey or a study done by some people in health economics in the AUC with the Ain Shams University in Cairo. They did a very small survey. They discovered that early detection and early management and early awareness and early treatment, thrombectomy or thrombolysis, saved the country in this small sample by 325 million Egyptian pounds. And this was a small sample. So putting all these numbers together, and numbers are the key word. I believe in all my work that I have to refer to numbers to take my decision. So now stroke has to be put on the top of the list of our concerns as a government.
With 100 days to the United Nations high-level meeting on NCDs, find out how you can get behind the call for stroke action now and help put stroke at the top of the policy agenda.